Hi, a very good evening to all of you. Today we are going to see the case note of Evans Mallory, a 5-year-old child who has problems of anaphylactic reaction. So let us go to the writing task. In the writing task, we are supposed to write a letter to the family's local maternal and child health nurse. So the person is known to the caregiver. So the Evans and his or her family is very much in contact with Miss Ann Wilson, to the person the letter is to be addressed. Miss Ann Wilson is a maternal and child health nurse, maybe at the Maternal and Child Health Center in Melbourne. So she is the nurse to whom the letter is being written to. And what we need to include in this letter, we need to outline relevant information. So we don't need to outline irrelevant information. Only which is relevant to Miss Ann Wilson, we need to inform her and request follow-up on discharge. So what we have to do is that outlining relevant information, only things which are relevant to Ann. And the second thing is the follow-up on discharge. So on discharge, what things she needs to take care of the child and the mother. This is what we have to include in this particular letter. So let us go ahead and see in detail the relevant data, what we need there. The relevant data. The relevant data here, the first one is you are a charge nurse at St. Agnes Hospital, Melbourne. And today's date is February 22, 2020. So you have a 5-year-old Evans Mallory. So if you are writing 5 years old, then you don't write the date of birth. So family history is totally not necessary for the letter, because you are writing to the local maternal and child health nurse. The nurse knows you well. And this here, we don't need to include this thing. We don't need to include this thing. So none of these things is relevant to the letter. So we are going to write from the presenting complaint. So what exactly is the presenting complaint? The presenting complaint. While having breakfast, Evans had abdominal pain, vomiting, and profuse watery diarrhea. And what type of breakfast he had or she had is milk-based food. So that the potential allergic food is milk-based food, one. So we can understand that may be the reason. Now, after developing the food allergy, he developed respiratory problems like this, respiratory distress and wheeze. And when the ambulance arrived, He had severe stridor, increased work of breathing, and was only responsive to pain. So he had all the respiratory problems, and it was worsening. And what exactly was the condition of Evans at the time of receiving? When we received Evans to the hospital, he was responding, or she was responding, only to pain. This was the condition. Now, that's something we have to brief. We don't need to explain it. Now, what we have, the GCS, general examination, GCS is there. Then we had stridor, tracheal tug, subcostal intercortical recession using accessory muscles. You had the symptoms, flushing, urticaria, saturation, movement, pulse going up, expiratory breath and spider. These are all symptoms of this allergic reaction, which it's acute in nature. Acute anaphylactic reaction was confirmed based on the general examination, presenting complaint, and the verbalization of his or her mother. What is that? Milk-based food. That's a subjective data by the patient relative. So here the patient relative is his or her mother. Now, what is exactly what we can see after confirming the diagnosis? We have the management. So inside the ambulance, we have given adrenaline, epinephrine, and we were monitoring, and we were giving oxygen, salbutamol. So what we have given, actually, the medicines we have given, adrenaline, salbutamol, and we have given chlorpheniramine as an antihistamine, and oxygen saturation. So that was the treatment. So medications included chlorpheniramine and adrenaline. So other therapies included oxygen and salbutamol. So what is the management? Medical and non-medical management is there. So right now the condition of Evans is stable after having antihistamines, all these supportive therapies like oxygen and nebulization therapy. Right now Evans is stable. Now we need to educate the mother of Evans regarding the importance of food which has to be given and which has not to be given. So foods which you should not give, foods which you have to give. Education is needed. Education is needed regarding the use of adrenaline pen, both to Evans and mother. Now we have to do some tests. So need to request the nurse to do the test to confirm the potential culprit food. So RAS test is there, specific IgE test is there, skin prick test is there. So you have a lot of tests to confirm potential culprits food. And right now we need the support. The family needs support financially, and the support group also should support the family in case of group activities, childcare activities and all. And that's all the requirements and follow-up care. So that's the outline there. So what we have to do here, we are going to write the letter that's on 22 February 2020, and Wilson, Miss Wilson Evans Mallory, aged 5. The purpose of this letter is to update the condition of Evans Mallory, who has been under our care for the treatment of acute anaphylactic reaction. So the condition is already mentioned. He was or she was under our care for the treatment of anaphylactic reaction. So why it's written the child requires, why you don't write he or she? Because you have no indication that it is he or she in the question. Even though you can guess that's a girl, two brothers, it can be boy too, because it can be sister, it can be a brother too. So now we cannot make assumptions that this is he or she. So we have mentioned it's the child. The child requires follow-up care and support after being discharged from our care. Evans was brought via ambulance after exhibiting symptoms of food allergy. Okay, I can say at home, which later worsened to wheeze and respiratory distress. At the time of transportation to our hospital. So, which later worsened to wheeze and respiratory distress at the time of transportation to our hospital. At the time of transportation to our hospital, he has developed wheeze and respiratory distress. Yes, yes. Okay. Now, I don't need that actually, but because it's not that much relevant there. I just am satisfied with that data. The child was responding only to pain at the time of admission when he was received by us via ambulance. The only response was to the sense of pain. That's what we can see there. You can see there, responsive to pain. Yes, only responsive to pain. Now, after that, we are confirming the diagnosis based on the symptoms, examinations, and the child's mother, Miss Margaret's verbalization. Diagnosis was confirmed. Which diagnosis? The aforementioned diagnosis was confirmed. So the aforementioned diagnosis, that's acute anaphylactic reaction, was confirmed based on the symptoms of events, examinations done on event, and the verbalization, based on the verbalization of Mrs. Margaret, the mother of events. So what we can do here, that's the treatment, that's the second paragraph after the purpose. He was treated conservatively with adrenaline and chlorpheniramine, oxygen, and was supplemented, and salbutamol nebulization was given as adjuvant therapies to stabilize his condition. So in order to stabilize is to pacify his condition. To calm him down, we have given oxygen because his saturation was going lower than the limit, and we had his pulse rate moving up. So we had to pacify him. So adjuvant therapy was given. He became, in order to stabilize him, all these things were done. So upon discharge, it would be appreciable if you could arrange specific tests for events, including skin prick, serum IgE, and rash to potential culprit food. So you have to go ahead with specific tests. Please arrange specific tests for events. That includes skin prick, serum specific immunoglobulin, and rest to potential culprit food. So we have the test there, it's mentioned there, which all tests we need to do. Both the child and the mother need education. Of not, both the child and the mother need education regarding the use of intramuscular adrenaline pen. So adrenaline pen, IM adrenaline pen, you have to use. So in case of any emergency, in case of any such reactions which may happen in future, so the mother and the child, because his father or her father is separated from the mother, so only the mother is the caregiver. So the mother and the child should know how to use the pen. And kindly educate Miss Margaret regarding non-recommended food. So recommended food lists you'll be giving there, but you should not give these foods such as peanuts, cow milk, and shellfish. Integrate her to support groups. She may also need the service of a financial counselor. So that's the tail there. And if you have any further queries regarding Ivan's condition, please do not hesitate to contact me. Yours sincerely, Charge Nurse, St. Agnes Hospital. So if you want, you can just join these two paragraphs. So no problem. So you can, if you want to separate that paragraph, that is the presenting complaints, examinations, and the treatment. So, or if you want to join, no problem. If you want to separate, no problem. So we have almost the letter drafted in an attractive form. So don't worry if you split into smaller paragraphs. Okay, I just made it together. So there's no this is what we have to, if you see, if what is the content of this paragraph. The content of this paragraph is outlining the condition of events, and what is the content of this paragraph is what are the requirements of events. So I can say two specific paragraph, two specific purpose for the paragraph, and it is organized in such a way. No problem. Thank you.